Good afternoon, everybody. We're going to be hearing many things this afternoon in relation to health, in relation to politics, and in relation to history. My role this afternoon is to try to put some of the things that we're going to be hearing into some sort of context. A context that explains how we got here today. Not just how we got here in the physical sense, in this place, here this afternoon, but how we, Europe and the world, arrived at this point in time. And to do this, I'm going to frame it in the context of the work that Dr. Rath, Dr. Mitswiki, and our foundation have been doing successively for 20 years now. And describing how, if you like, our moves on the European and then global chessboard relate to and influence even the moves of the drug cartel and this thing we call the Brussels EU. I'm going to begin with a photograph that I guess all of us are fairly familiar with now. This was the signing of what are called the Treaties of Rome. This was the beginning of the Brussels EU as we know it today. It was actually, as we have explained in our writings, in our books, and on our internet site, this was the start of the cartel's third attempt at conquest of Europe and then the world. But there's an important question that we haven't touched on in this context, and it's this. It's with the cartel's Nazi blueprint already in place on the day these treaties were signed. Why were there then no major developments in the enforcing and carrying out of this blueprint for another 35 years? This is an important question because clearly something changed after 35 years to bring about the now rapid pace that the EU is being enforced upon us. If we look back to 1990, the world and the perceived future practice of medicine were very different. And the first answer to the question I just posed as to why there were no significant developments for 35 years was that by 1990 the drug cartel essentially believed that its European business with disease was already secure. At that point, it would have been possible for the doctors emerging from medical schools and the pharmaceutical executives to imagine and envisage a future that was pharmaceutical dependency for the world. It was the only game in town, as it were. Europe already by that point accounted for the largest share of the drug industry in the world, with North America coming shortly close behind that. But then this happened. In 1991, Dr. Rath published probably the most important paper in the history of cardiovascular disease research. And it provided the solution to the puzzle of heart disease. Because until that point, whilst drugs and treatments had been offered for this, none of them had identified or correctly treated the root causes of this disease. Dr. Rath's publication of this paper followed a succession of key papers that led up to this, and these papers were produced from around 1989 onwards. And to anybody who read this paper at this time, to anybody who took the time to understand it, it will have been immediately obvious that there were new natural possibilities for the control of this disease, and that this represented a serious economic threat to the financial base, or the financial basis even, of the drug industry. The following year, the Brussels EU took arguably the biggest step it had taken in its development for 35 years. And this was something called the Maastricht Treaty. This was signed in 1992. It contained a lot of things, but there's two elements that I feel are particularly important for us to understand. The first is it prepared for what it called economic and monetary union. This was the very beginnings of the process that led up to the creation, the eventual creation of the euro currency, that is wreaking havoc, in fact, now upon Europe today. The goal of this was to give the cartel, multinational corporations, control over Europe, over the economies. But there was something else in this treaty as well, because it established what the Brussels EU calls consumer protection policies. And the goal here was to enable the cartel to use these as a cover for enforcing its interests. And in due course, which I'll describe in a little more detail in a few minutes, these consumer protection policies that were brought about through this treaty led to something called the Food Supplements Directive, which is now the law that controls food supplements in Europe, including what we can say about them. In 1992, already it was clear that in the United States, vitamins were a big story. This magazine cover was from Time magazine. It was published in April 1992. And it provides a clear sign that Dr. Rath's heart disease breakthrough was spreading like wildfire at that point. The cover story you can see is the real power of vitamins. New research, it says, shows they may help fight cancer, heart disease, and the ravages of aging. There was a reaction from the drug cartel in the United States to this. But it actually had the opposite effect to what the drug cartel was hoping for. Because the consumer reaction to this was so great that it actually resulted in 1994 with the US government passing a law to protect and preserve access to vitamins and vitamin therapies in the United States. This law, for those of us who have studied it, while it's not perfect, it's arguably the perfect template that should and could be copied by other countries to preserve access to vitamins in other parts of the world as well. With the realization in the United States that the drug cartel was already losing this battle, it took its fight to the global stage. It escalated its activities to the global level. And it did this through something called Codex, which some of you will no doubt already be aware of. Codex is the Codex Alimentarius Commission. It's an organ of the United Nations, and it receives its funding from two United Nations organisations. You see the Food and Agriculture Organisation and the World Health Organisation. Today, the Brussels EU is a huge influence on this, because the Brussels EU countries are bound together in law, and this essentially results in their having to argue as one 27-country bloc at Codex for what it wants. So now what we're seeing today at global level through Codex is that the global standards that Codex passes are essentially starting to take on parts of European law. European law is being interjected into the standards and guidelines that Codex produces. But of course, as we'll talk about more this afternoon, the pharma cartel essentially controls the Brussels EU. It has a huge influence and control over it, and we'll get into that in a little while. Dr. Rath was the first person in the world to draw global attention to the fact that the German government was leading the Codex effort to ban vitamin therapies. And in June 1997, he gave a now famous lecture in the City Hall in Chemnitz, in which he publicly revealed that the German government was spearheading these efforts primarily printed at that time on behalf of German pharmaceutical and chemical corporations. And the goal here was to ban vitamin therapies worldwide. So already by 1997, Dr. Rath's heart disease paper had already escalated this into a global battle. There was a battle taking place, which is still taking place today, over this. Contrast what I've just described about what happened in the United States with the passing of the laws to protect vitamin therapies with the response of the Brussels EU in 1997. Because here, almost for the first time, we see a clear intent to deceive the people of Europe. Here, Article 129A. Does anybody really believe that the Brussels EU is meaning any of this stuff? Listen to this. In order to promote the interests of consumers and to ensure a high level of consumer protection, the community, that's the Brussels EU, shall contribute to protecting the health, safety and economic interests of consumers. Well, that's not happening today, is it? As well as promoting their right to information, education, and to organise themselves in order to safeguard their interests. Let's just look at parts of this again. Promote the interests of consumers, protecting consumers' health. This is not what the Brussels EU is doing today. This treaty was a deliberate attempt to deceive us about the Brussels EU and its role in interference in our lives. We also know for a fact that this treaty was hugely influenced by the cartel. Some academics in universities in England and Scotland have published evidence, proof, showing that these corporations, SmithKline Beecham, now part of Glaxo, Zeneca, now AstraZeneca, Bayer, and Shell, oil and drug cartel companies. These companies successfully were able to insert their language, their intent, and to influence the Amsterdam Treaty to ensure that it protected cartel corporation interests. This is a fact. In 1998, in a public meeting known as the Berlin Tribunal, Dr. Rath openly charged the cartel and its accomplices in politics, the media and science with mass murder. Perhaps today, in the year 2013, this might not be so shocking to us. But in 1998, as Dr. Rath will testify, this was deeply shocking to many people. At that time, the media was not like today. Today we are already seeing criticism of the farming industry. We are seeing reporting on the fraudulent nature, the criminal nature, in fact, of the farming industry. But at that time, to identify this industry as a criminal industry and to charge it with mass murder was deeply shocking to very many people. The Nice Treaty was passed within only a couple of years of this, and what this did was to give the cartel countries, the biggest cartel countries in Europe, the biggest say and control over what happens in the European decision making. So, in the European Council, the main cartel countries, Germany, France and the UK, but also Italy, now effectively hold the balance of power. And the Nice Treaty did this. But not just that, because this treaty also increased and redistributed the number of seats in the European Parliament, again in favour of the main cartel countries, Germany, France, Britain, and also Italy. And then this. At this point we already had the solution to the puzzle of heart disease. But in March 2002, Dr. Rath and Dr. Mitsviki in the USA Today newspaper announced this, a breakthrough discovery that the spread of all cancer cells can be inhibited naturally. At this point, if you like, the drug industry was engaged in a two-point pincer movement. Its two biggest earning diseases, the two biggest killers, then and now, and natural solutions to these diseases were openly being advertised like this, for people to become aware of and learn about. A matter of days later, less than a week later, I think it was 4 or 5 days, and despite massive public opposition, the Brussels EU Parliament passed this thing I mentioned earlier, the Food Supplements Directive. The outcry to this was so enormous that it actually resulted, for the first and only time ever, in the number of emails being sent by concerned citizens actually crashing the European Parliament's server. The European Parliament took action after that in the attempt to ensure that this could not happen again. But it gives you an idea of the scale of opposition to this directive. Because what it does, it plans for the eventual setting of restrictive upper limits for vitamins in supplements. And it prohibits claims that supplements are suitable for the use in the prevention, the treatment, or the cure of disease. And this came a matter of days after the announcement in the USA Today newspaper. And then 2003, Dr. Nisviki mentioned this event a few moments ago in her introduction. This was the event at which August Kowalczyk made his first public association with our organisation. Dr. Rath and the Foundation submitted a complaint to the International Criminal Court in The Hague. It's hard to imagine a more truly global action on our behalf. And this complaint detailed genocide and other crimes against humanity in connection with the cartel's business of disease, and also against the war in Iraq, which was taking place at that time. By 2005, the cartel was so intent upon controlling vitamins at the global level, through the Brussels EU, it succeeded in passing some global vitamin guidelines at Codex. And these were finalised and adopted as a global standard in July 2005. And again, this is one of the first instances where we start to see parts of the text from European law, in this case the Food Supplements Directive, being directly lifted and planted into global law at Codex. There are sections of text in the Codex guidelines, global guidelines, that are identical, word for word, to the content in European law. So we've seen now growth in this battle, and the European reaction now being passed up and attempted to be imposed globally. For anybody who's not yet convinced of the influence that the cartel has at Codex, take a look at this. A little while ago, this influenced me, it's interested me, because I've actually attended Codex meetings as an observer, and I've seen representatives from some of these companies there, but I look back over all of the reports for one particular committee. This is the Codex Committee on Nutrition, because this was the committee that drew up the vitamin guidelines I talked about a moment ago. And it's a who's who of the biggest cartel companies. They're all there. Some of them, since that time, have merged into other companies. But these are the biggest players in the global drug market. And they're all attending these meetings. And they're not doing it by accident. They're not going there to pass the time of day. They're going there to protect their interests, their financial and economic interests. In July 2007, with our activities by then firmly established on the global stage, we published this advert in the New York Times. The New York Times is like the world's newspaper. It's produced in the city that contains the seats of the United Nations. And this followed a lot of research that we've been conducting in the international archives. And one of the things that we uncovered were the forgotten documents from the Nuremberg war crimes tribunals against IG Farben. Because any of you don't know that managers of IG Farben and the executives were tried after the war as war criminals. And so we published this in the New York Times to show the world that the oil and drug cartel had been behind World War II and that they were charged as war criminals as a result of this. And it was said in the trial at that time, after the war, that without IG Farben, World War II would not have happened. 6 months later, at the European level, there was a reaction to that because the Brussels EU had been trying to pass what it called the European Constitution. This constitution was rejected in votes in France and in the Netherlands as well. And then history stopped it, they realised. So then what they did, they changed about 0.5% of it, and they called it the Lisbon Treaty, and they brought it in without essentially any votes for 99% of the people of Europe taking place at all. And this was a clear step, and a clear indication to us that the goal was still what it was at the outset, the implementation of a European-wide dictatorship. A dictatorship forming the plan for a future Europe that is completely undemocratic. A Europe organised not in our interests, but in the interests of cartel companies, multinational corporations. Just as I move towards the close of what I'm saying this afternoon, I'd just like to give you a little idea of how the laws in Europe are made, for those of you who don't understand this yet. We know from the Amsterdam Treaty that cartel companies have proven to have influence over European law and European lawmaking and European treaties. Cartel company managers have open access to Brussels EU commissioners. This is not something that we, the people, have for ourselves. And they instruct the Brussels EU Commission to protect its interests by issuing directives. Draft directives are issued by the Commission and handed down to the European Parliament for consideration. But it's not possible for the European Parliament to make radical changes to these. The changes, for the most part, are essentially very small. Even the term directives is mentioned in the Nazi blueprint. This is not a new term at all. And then, of course, once the EU Parliament has essentially rubber-stamped these directives, they get handed down to national parliaments, who, as members of the Brussels EU, have essentially no choice but to implement them into national law in their countries. So in April 2010 we published this. This book was the synthesis of everything we had learned essentially up to that point about the Brussels EU, its history, its background, and how it operates. And this book proves, as the Nuremberg documents prove and other research documents we have prove, that the key architects for the Brussels EU were recruited from among the same people, the same technocrats who were previously designed the plans for the Europe that the Nazis and IG Farben were planning to bring about after the end of World War II. And then this. You'll be hearing a lot more about body XQ this afternoon. It's not my role to talk about this. But in trying to sum up why this is important, I came across something that Dr. Rath wrote in an email a few months ago, and I wrote this down because it felt important. This is what it says. It said that throughout history, illiteracy has been the strongest force obstructing the progress of humanity. The next great step forward for all mankind is the liberation from health illiteracy. The liberation of mankind from being kept in ignorance about the workings of our bodies and the ways in which nutrition and health impacts upon us. We can take this a step further because there's also, I guess, something called political illiteracy. The people of the world have been kept illiterate about the political situations they are living in, about the historical facts that have brought about the Europe of today. Political literacy, I guess, in some ways is just as dangerous as health literacy, because it keeps us ignorant of the facts, and if we are ignorant of the truth, we are unable to act. So the truth is obviously all about what this afternoon is about.